Good evening, everyone. My name is Ben, and I'm a health educator at the Hospital Research Foundation group Arthritis, and I thank you for all joining us tonight. First and foremost, I'd like to have an acknowledgement of country. I acknowledge that myself and our presenters tonight present from Ghana land, and we pay respects to elders past, present, and emerging. I'd first like to raise as well that this webinar has been made possible through funding from the Country SA Primary Health Network, and we thank them for this. The other thing that I'd like to raise first and foremost is that you might have questions during this entire webinar, and I really like to highlight every time that the question and answer feature is open during the entire session. Now, I've got a really exciting one tonight. We've got two presenters from the SA Pharmacy Medicines Information Service, and they're Corey Borg and Elise Policina. Now, if you've never talked to the SA Pharmacy Medicines Information Service, they receive at least 10,000 inquiries every year, and they provide advice to both health professionals and the general public regarding the use of medicines during pregnancy, breastfeeding, and then also for adults. So any question inquiry that you've got about your medicines, maybe you can't get into your pharmacy, you can't see your doctor at that time, they're a fantastic and free service. The two pharmacists that we have presenting, firstly, Corey is the acting lead pharmacist for the SA Pharmacy Medicines Information Service. He has training responsibilities with the SA Pharmacy Residency Program and the SA Pharmacy Intern Pharmacists. He's an active member of the statewide parental practice group and has previously served on both the SHPA Education Committee and the SA Pharmacy Residency Committee. Corey regularly provides teaching and education to members of the public and then other health professionals through University of South Australia. Elise Policina is a senior pharmacist working both in clinical pharmacy educator and the SA Pharmacy Medicines Information Service. Elise is currently serving a position on the statewide SA Pharmacy Medication Profiler Committee, as well as the SA Pharmacy Education Group. She has a strong interest in the areas of medication safety and the quality use of medicines. Elise is passionate about sharing her knowledge to educate and empower patients and consumers around their medications. So we're very lucky to have both these presenters tonight, and I'll hand over to them.
So good evening, everyone. As Ben mentioned, my name's Corey.
And my name is Elise.
And we're medicines information pharmacists working with SA Pharmacy at the Women's and Children's Hospital here in South Australia. Again, I'd just like to extend our thanks to Ben and the Hospital Research Foundation group Arthritis for inviting us to speak with you today. And thank you for choosing to spend your Tuesday night with Elise and I as well. So tonight we're going to talk about medicine packaging labels and try and answer some questions you may ask yourself when you pick up a medicine box. I'm sure I'm not the only person who's walked into a pharmacy and felt a bit overwhelmed by the number of products that are available. You might have picked up a box and seen there appears to be some really deliberate words used. There might even be some obscure numbers written on it. What does it all mean? So by the end of the session, we hope you'll feel more comfortable understanding your medicines and ultimately help you have a conversation with your healthcare professional or provider so they can help make the right medicine decisions for your health. So before we begin, we'd also like to start by acknowledging the traditional custodians of country throughout Australia and their connection to land, sea, waters and community. We recognise the history of Aboriginal and Torres Strait Islander people's vast knowledge in native plants and their uses, and that culture and country provide medicines and healing. They were our first pharmacists. We pay our respects to their elders past, present and emerging, and extend that respect to all Aboriginal people today. So just very briefly, and Ben's touched on this, but who are we at Medicines Information? So we're pharmacists and our main role is to provide patient-focused advice about medicines. We respond to over 10,000 inquiries each year, and our questions come from healthcare professionals such as pharmacists, doctors, nurses, as well as members of the public like yourself. We also provide education, training and research. And we're physically located at the Women's and Children's Hospital here in SA, and we operate 9 AM to 5 PM weekdays. And the service is available to all South Australians, so this includes healthcare professionals and members of the public. So for tonight's presentation, we'll be talking about medicine packaging, but first we'll start off with what we mean when we talk about the evidence of medicines. Then we'll discuss what healthcare professionals or your pharmacist might think about when suggesting a medicine to you. We'll explore how medicines are regulated in Australia, and even about unregulated medicines and the problems they may have. And what does this OST-L and OST-R mean? We'll show you how to read medicine packaging and some clues as to what the packaging is telling us. And lastly, we'll go through where to get reputable information or who you might be able to ask for some help. At the end of the presentation, there will be the opportunity for any questions you may have, which we're more than happy to answer.
So let's get into it. To start off our talk, we wanted to explain what we mean by evidence and why is it important when it comes to medicines. By evidence, we're referring to the proof that shows whether a medicine actually works and is safe for a specific health condition. For example, does medicine A treat my arthritis pain, and is it safe? There are many different types of research we can do to get this information, and some research is better than others. Understanding this information means that we can trust that a particular medicine is the best choice for our health. When we are looking at the evidence of a medicine, we need to see if research shows that the medicine has worked well in many different people, not just a handful of individuals. We're talking thousands of individuals. The information we gain from the research that showed it worked in thousands of people is much more valuable to us because we are able to be more confident that the results are true and not just by chance, as opposed to the information we have gained from a handful of individuals. It makes it harder for us to trust that we can broadly generalize that information gained from a few individuals to then the whole population. To give you an example of what we mean, we have a review article of topical anti-inflammatory creams for musculoskeletal pain in adults, which you can see included over 10,000 participants. Compare that to a review article of curcumin or turmeric, and there are just over 1,000 participants. That's basically a 10-fold difference in the size of the study. So the curcumin study is 10 times smaller than that of the topical anti-inflammatory one. With smaller studies, it can make it hard to then apply the findings of that study to the whole population. With more people included in the study, we are able to trust the information is valid and not just a coincidence. As pharmacists, before we recommend a product to you, there are a few things we will think about to make sure the choice is right for you. There are three main aspects to choosing the right medicine that your healthcare professionals will think about. Is the medicine safe for you? Is it trustworthy, or is it a quality product? And does it work, also known as the efficacy? First and foremost, when healthcare professionals consider medicines, the first thing they look at is its safety. This means we are checking if the medicine is safe for you to take by considering your health, other medicines you might be taking, and any allergies you have. Safety also involves making sure the medicine has minimal side effects and is unlikely to cause you harm if taken as recommended. As healthcare professionals, our number one rule is do no harm to our patients. Are we using medicines that come from a trustworthy source? That is, can we consider them to be quality products? And by this, we mean, is the medicine coming from a reliable source and made in a reliable way? In Australia, manufacturers of medicines need to meet strict government standards, so we can trust that they contain what is on the label and that there are no hidden unsafe ingredients in the product. For example, working in the hospital here, we've seen many people on multivitamins which have been contaminated with lead, which can lead to all kinds of serious health problems. And this was from a product which obviously did not contain what was on the label. If we know the medicine is trustworthy, it gives us further confidence in using them. Finally, does the medicine actually work? Efficacy is the term health professionals use to describe if a medicine works. Healthcare professionals consider evidence from research and studies that show if the medicine works to treat specific symptoms or medical conditions. It's about ensuring that the medicine will actually help you feel better based on solid proof. And as we said earlier, gathering evidence comes from years of testing, sometimes involving thousands of people, so that we are confident that the medicine works as intended and brings more benefits than side effects. So we've spoken about what is evidence and the different types of evidence health professionals will consider when recommending or prescribing a medicine. But now we just wanted to touch on what we classify as not evidence. Commonly, we will hear statements such as, "This worked really well for my auntie who also has arthritis," or "This was used for joint pain in ancient times." This is anecdotal evidence based on one or a few individuals' experience and is not evidence-based. As we mentioned previously, just because a medicine worked well in one person doesn't mean that we can say it worked well for everyone. Health conditions can be so variable between individuals, and we need to take into account much more than individuals' experiences when recommending medicines. You may also hear doing it the natural way is always better. But a statement like this is opinion-based and not backed up by any scientific evidence. Googling, reading blogs, Facebook posts, or magazine articles is not always presenting the most up-to-date and reliable information.
Thanks, Elise. So this might be a familiar face to some people. Here we have our legendary Australian swimming champion, Dawn Fraser. And you might be thinking, what does Dawn Fraser have to do with our presentation about medicine packaging? But Dawn throughout the years was really vocal about her experience with arthritis and the impact it had on her life after her swimming career. Excuse me. So Dawn Fraser was previously paid by the medicine company Bioglan and promoted their product True Strength Glucosamine Slow Release Tablets, which claimed to work better than the plain glucosamine tablets. Her ads were often shown on TV and were very relatable to people who grew up watching her swim. There was even an ad that was shown suggesting that the True Strength Glucosamine tablets was the reason she was able to appear on the TV show Dancing with the Stars. Now, Elise has just spoken about how government-approved medicines are trustworthy, but when we see celebrities endorsing these products, they must be really good because Dawn Fraser was a really good swimmer, right? However, there's no proof or evidence for Bioglan's claim. And in fact, in general, the evidence for glucosamine is mixed. Some results from older research showed that glucosamine worked and some did not. And interestingly, the studies that found it worked were all sponsored by the pharmaceutical company who made a specific glucosamine product. So this is a huge conflict of interest because they're obviously trying to sell their product to make money. Many national and international organizations who specialize in treating osteoarthritis do not recommend the use of glucosamine. But Australian guidelines do suggest if you're wanting to try glucosamine medicines for osteoarthritis, you can try them for a few months. If no benefit is seen after this time, then it's recommended to stop. So essentially, you can try it if you like, but if you still feel the same way after a couple of months, so it hasn't made any difference, save your money and try something else. But if you do like it, that's okay, it's your choice. But based off the evidence that we have so far, it's hard to say if it'll actually help everyone. So we've spent some time going through the three factors of safety, trustworthiness or quality, and if a medicine works, so its efficacy. But who in Australia looks after this? How can we know or be reassured that the medicine we picked up off the shelf has been assessed for these three factors? It's something called the TGA. So the Therapeutic Goods Administration, or the TGA, is our Australian government organisation who's responsible for regulating and approving therapeutic goods in Australia. And by therapeutic goods, this includes all medicines, from prescription medicines all the way through to vitamins and herbal supplements. For medicines to be sold in Australia, they have to be listed or registered with the TGA. So basically, we can think of the TGA as our safety net. They take away the guesswork for us in determining which medicines are safe to use. Once the TGA has assessed and approved a medicine, they are listed on the Australian Register of Therapeutic Goods, bit of a mouthful, also known as the ARTG. And these medicines will be assigned either an OST-L number or an OST-R number. So you're probably asking what is an OST-L or an OST-R number? So we'll start with our OST-L, or listed medicines. So these medicines are deemed low risk by the TGA and are listed and assigned an OST-L number. These low risk medicines are less likely to cause harm and contain ingredients generally known to be safe, with a low chance of causing side effects when you're used as directed on the packaging. This might include supplements such as fish oil, magnesium, or turmeric. So they're used for minor health conditions, so simple everyday health problems like a common cold or muscle aches, rather than for serious medical conditions. You can purchase these types of products off the shelf from pharmacies, health food shops, and even your supermarkets, and they'll include things like your vitamin and mineral supplements, herbal medicines, traditional Indian and Chinese medicines, and aromatherapy oils as well. And you can see some of the images below. There might be some products that you recognize that you've probably seen in your pharmacy or local shop as well. So listed medicines are not individually evaluated by the TGA, and they're assessed for safety and quality, but not whether it actually works. So the question really is not really whether the listed medicine is going to harm you, it's whether it's actually going to help you at all. OST-L or listed medicines can only make low-risk claims, and to make a claim about a product, the TGA requires a company to certify that they hold evidence to support the medicine actually works. The key word here is hold. They don't actually have to show the TGA the evidence for it to be sold in Australia. The company basically just has to promise they have it somewhere in case they're audited. And there is a predetermined list of ingredients and amounts of these ingredients that are set out by the TGA that listed medicines are allowed to contain. So as long as companies are following this list, then the TGA consider these products to be low risk. The TGA will actually review random products that are marketed in Australia. And if a company is audited or reviewed, the company might be required to provide the evidence of efficacy and that they're actually following the TGA rules. If that particular product does not comply, the product might be suspended or it might be completely removed from sale. So let's take a look at an example of a listed medicine or an OST-L medicine. And in this case, we've got a glucosamine tablet. So the TGA does not approve the medicine packaging before it reaches the market. Whatever appears on this label does not need to be assessed before the company can sell it in Australia. So listed products can only write what they can be used for on their packaging from a list of predetermined or pre-worded uses for the medicines that are set out by the TGA. So if we look at the glucosamine product on the screen, we can see an example of the type of wording we may see on packaging, such as relieves symptoms of mild arthritis, mild joint aches and pains, and supports joint mobility. In this case, you can see it's the OST-L number, or the listed number, is on the front of the bottle. So we know this type of medicine has been approved by the TGA for safety and quality, or its trustworthiness. Medicines that are considered high risk or higher risk by the TGA are registered or assigned an OST-R number. And they're used to treat more serious illnesses such as rheumatoid arthritis. These will include all prescription medicines, so things like antibiotics or blood pressure medicines, many of the over-the-counter medicines, for example, Panadol or paracetamol, and even some complementary medicines have an OST-R or a registered product. They're mainly purchased from pharmacies, but they can sometimes be found in supermarkets. So things like Panadol and Nurofen are registered products, but they can be found in like your local Coles or Woolies. And again, on screen, you can see just a selection of medicines that are registered products in Australia. So to highlight an example of a registered or an OST-R medicine, we have Panadol Osteo, which many of us may be familiar with. Again, if we zoom into the left here, we can see the unique OST-R number. So we know the TGA has assessed this medicine for safety, quality, but also efficacy. So does it actually work? And sometimes it feels like you need to play a bit of Where's Wally to locate this number. It's not always in the same spot, but I guess this is sort of the number you can look for to know if it's registered or listed. So because they're high-risk medicines, the TGA assesses all registered or OST-R medicines individually. And so by that, we mean a particular product line will be assessed before they're brought to the market. The TGA will assess each medicine to see if they're safe, trustworthy, as well as whether they work. And the evidence required to show the TGA for registered medicines needs to be quite strong and detailed. So these medicines, as Elise mentioned, often undergo years of testing on thousands and thousands of people, and the drug company must provide very comprehensive evidence to prove that the medicine actually works. So I'll hand over to Elise.
So we've spoken so far a lot about how medicines are regulated in Australia, as well as OST-L and OST-R products. Now, let's talk through how to read medicine packaging labels using two different products as examples. So here we have a box of Voltaren as our first example. So first up, we have the brand name. So the name of the product that is given by the drug company. So in this case, it's Voltaren. Next, we have the name of the active ingredient or the generic name. And that's the name of the ingredient or the drug that's treating the condition or symptoms we are using it for. So for this product, it's diclofenac. Next, we have the strength of the drug. So this shows us how much of the active ingredient is in each tablet. So these Voltaren tablets contain 12.5 milligrams of diclofenac per tablet. Then we have the OST number. So this number tells us if the product is OST-L or OST-R, and then is followed by a unique number, like Corey said. This not only will identify the product, but just as we've talked about, it gives us a guide or some clues as to how much the TGA has analysed the product before going on the market. So Voltaren tablets are OST-R, and remember with OST-R products, the drug companies have had to provide lots of strong evidence to show that their drug actually works well for what it is designed to do. Then lastly, we have the use of the medicine. So medicines that can be bought over the counter or off the shelf will have a use of the medicine on the packaging, as well as directions for how to use the medicine on the back of the packaging. So in this case, Voltaren is used to treat back and muscle pain. For prescription medicines, so those medicines that you need a script from your doctor to buy, these medicines are not allowed to display a use on the packaging. Your pharmacist will then add an additional label onto those products with directions on how to use the prescription medicines. So next we'll move on to another product, and we'll go through those elements to medicine packaging that we've just spoken about on this next product. So first here we have the brand name, so Pananatra, and you might be thinking, hey, that sort of looks like the brand Panadol to me. Well, it is made by the same company as Panadol, who have cleverly marketed this product as Pananatra, which kind of sounds like natural Panadol, right? We'll move on to the use of the medicine. So it's being used for joint pain relief. Then next we have a list of the active ingredients and the strengths of those ingredients in each tablet. So if we take a bit of a closer look, we have curcumin extract, boswellia, and piper nigrum. There is some, but not a lot of information to say that the curcumin and boswellia has anti-inflammatory properties and works well for some osteoarthritis pain. But these anti-inflammatory effects are considered weak compared to that, for example, of taking Nurofen or Voltaren tablets. Animal studies have shown that piper nigrum can also help treat inflammatory symptoms like osteoarthritis. But again, the key word there is animal, and we are humans. And whilst animal studies can give us helpful clues, the medicine may not always work the same way in humans. And prescription medicines will always require human studies before they are approved. Down the bottom of the product, we have the OST number. So Pananatra is OST-L. Remember, OST-L numbers have not, or products that have OST-L numbers, they have not been assessed by the TGA as to whether they work or not. The company hasn't even had to show the government evidence the product does work before they marketed this product in shops. And here we have the medicine claims. And like all OST-L products, we can see the product has pretty similar wording to the products we've previously shown throughout the presentation, like the glucosamine tablets. So we have mild joint aches, pain, inflammation. It's using that same predetermined wording that other OST-L products have to use on their packaging. So these elements are just highlighting how some companies will try and use marketing to draw people into their products by playing on trusted, well-known brands, like Panadol in this case, that we all know and use. So tonight we've spoken a lot about how medicines are regulated in Australia and how to find that information on the packaging. But what if you can't find any of that information on a medicine box? Well, it's likely that the medicine is not regulated by the TGA and you are looking at an unregulated medicine. Buying unregulated products, for example, buying medicines online, can be harmful and risky. We can't be confident that we know what is in the products, how they are made, if they actually even contain the ingredients listed. Unregulated products may be counterfeit products, contaminated with toxic chemicals, or contain extra ingredients that should not be in there and could potentially be harmful or illegal. The TGA will randomly test products that come into Australia from overseas and put out safety alerts after testing these products for quality or trustworthiness and safety. One alert that was recently published by the TGA just at the end of January this year was about the product called Arthritis, which could be purchased online from overseas and was marketed for arthritis. So this was a complementary medicine that contained some active ingredients such as glucosamine, chondroitin, vitamin C, and curcumin. This product is not regulated by the TGA, so if you look at the packaging, it does not contain any of those OST-L or OST-R numbers. And after testing the tablets, they were found to actually contain undeclared ingredients, including diclofenac and dexamethasone. So those ingredients, dexamethasone and diclofenac at certain higher dosages, are prescription-only medicines in Australia. And the supply of Arthritis tablets in Australia is illegal. The use of these medicines unknowingly can pose really serious health problems. So diclofenac, which is an anti-inflammatory like Voltaren, can damage your kidneys, or you might overdose if you're already taking similar medicines. And dexamethasone is a corticosteroid. And when stopping this medicine suddenly, it can cause serious health problems. So to recap everything, we can see OST-R, or registered medicines, have been assessed by the TGA for all three aspects of safety, trustworthiness, so the quality, or efficacy, does the medicine work? Austell or listed products are approved for safety and quality, but are not required to prove they actually work before entering the market. And unregulated products are not assessed for anything and are very risky with great potential to harm. So we do not recommend purchasing unregulated products.
Cool. And just to finish off, we thought we'd conclude with an interesting case that you might be familiar with. I'm sure we all know of the brand Nurofen, which previously had a range of products targeting migraine, period, headache, and back pain. And you can see some examples on the screen. So what's the difference with all these products? So if we have a closer look at the ingredients, it shows us that they're all identical from product to product. They all contain ibuprofen 200 milligrams. So does the back pain version somehow magically go straight to your back and only your back as soon as you've swallowed it? What happens if you need to treat both your headache and your back pain? Do you need to take a dose of each? The answer is no, and definitely no. There were also television ads that use claims such as targeted relief, targets the source of pain, targets the site of pain, and they showed images of the medicine traveling through the body to the end in the head where your migraine might have been. So this line of products has actually been removed from the market now, and Nurofen now only sells their product more broadly for the relief of pain and inflammation. So really, we just want to highlight reading labels can actually be tricky, and it's important to get help, especially when you're unsure. Unfortunately, sometimes companies can deliberately trick or deceive us. So I guess, where do you go to get reliable information? And so we just want to highlight some ways of accessing medicines information in the community, as well as, and as we'll discuss today, having access to reputable and reliable medicines information is really important to make informed decisions about our healthcare. So some useful places you can get information on medicines include your local pharmacy or chemist. They can provide you with the consumer medicines information leaflet. It's a little piece of paper that comes in the box. Your GP or specialist, you can certainly discuss your treatment options with them and let them know if you want to start a supplement or a complementary medicine so that they can help review the safety with you for your healthcare needs. We've obviously got the Hospital Research Foundation Arthritis Group, who are a great source of information. And of course, we're here as well, Medicines Information, from another pharmacy perspective as well. So just to summarize our talk overall, medicines are approved and categorized into two main groups, and they are listed or Austell and registered or AustR medicines. If you see this labeled on a medicine box, you know the TGA considers them to be safe and made by a trustworthy source. However, only AustR or the registered medicines have been proven to work and have been provided to the TGA. Austell medicines may work, and we're certainly not saying they don't. However, we may not have enough information to confirm this. I guess overall, these are still considered a medicine, and they may make some medical conditions worse, or they may interact with some of your other medicines, which is really why it's important to speak with your healthcare professional, so your doctor, pharmacist, or nurse. And at the end of the day, taking a medicine is your choice. For example, if you wanted to try a listed medicine, we know that some of these medicines may not work or may not have a huge benefit, but you can try it. And if you still feel the same way after a few months or a few weeks, and it hasn't made a difference, we'd suggest saving your money and trying something else. But if you like it, that's great. It's your choice. But based off the evidence, it's hard to know who or if it'll actually help everyone. And that concludes our talk. Thank you for listening to us, and we can open the floor to any questions.
Perfect. Thank you so much for that, Cornelise. I think it's fantastic knowledge. We have had a few questions come through, and I'll start with the first one. The first is someone asking about that piece of paper that comes in some medicine boxes. Could you go a little bit more about what that actually is?
Yeah, so normally the piece of paper that comes inside the medicine box is called a Consumer Medicines Information Leaflet, or a CMI. So these CMIs are normally produced by the drug company, and it contains lots and lots of information, such as what is the drug used for, how to take the drug, potentially some side effects that are associated with taking the drug, and how to store the medicines. Just a word of warning almost, because the drug company makes those CMIs though, they will often include lots of information and may include every single side effect that could ever occur, for example. So they normally do that just to cover themselves. It's not something to be alarmed about, but it is important to recognise that and keep that in the back of your mind. And your doctor or pharmacist can certainly run through any questions that you may have relating to what's written on the CMI after you read it. Definitely we're all available to help you navigate some of that information that might be available on that CMI.
Delving a little bit more into those CMIs as well, with that big list of side effects, because a lot of people, especially viewers, maybe if they've been on things like, methotrexate, if they have an autoimmune type of arthritis, is there a way with those lists of side effects to kind of like split them up with like how common they can be?
There definitely are some of the side effects on the CMIs that are much more common than others. And, we as pharmacists or doctors will definitely have resources that are able to help convey to our patients what might be more common side effects and what they can actually expect from those medicines, the common side effects to expect compared to ones that are a lot more rare and have rarely been seen after using those medicines. So definitely by having a chat with us or your doctor, we'll be able to help clarify and navigate, what is more common compared to other side effects for particular medicines.
I guess one of the things I'll add as well is, using that methotrexate example too, is that we know that that medicine can be used for lots of different things. And this is both in the arthritis kind of world and spectrum, and then for all other kind of long-term medical health conditions, is that for a lot of the time, those CMIs don't know exactly why you're taking it. So those side effects, there might be different doses and things like that as well.
For sure.
Right. Next question we've got. Someone's asking if there are specific brands that the SA Pharmacy Medicines Information Service recommends for certain medicines.
Yeah, good question. There's no specific brands that we recommend. I guess different brands will contain the same active ingredient, so the same drug or medicine that's treating a condition, but it might be made in a slightly different way, and they might have some different, fillers, so like to make the tablet look nicer, or have different colors or flavors and things like that as well. Sometimes people might prefer some brands over others due to their individual preferences, so they might prefer capsules rather than tablets, or a certain liquid might have a nicer taste. Some tablets might be film coated, whereas others might be more powdery, so it's a bit more difficult to swallow. And also they might differ in their price. So ultimately it's up to you if you have a preference, but generally, no, we don't have any specific recommendations for brands. It's sort of up to the person, really.
Another question that someone's asked about is more so looking into kind of drug interactions. Is there anything specific online or in person or anyone they can call to find information about drug interactions?
Yeah, so with drug interactions for patients, I guess the CMI is a good place to start with. So often that CMI that I was speaking about actually earlier, the drug company, when they write those CMIs, will often list important drug interactions on there. But sometimes, again, like I mentioned before, they can be a bit overly cautious. Your doctor or pharmacist are the best people to talk to. They're able to check for drug interactions with not only your regular medicines, but also your medical conditions as well. We often are available, have many different resources available to help us, navigate the drug interactions and make decisions and help you take medicines most safely. So you can either, give us a call here in Medicines Information, talk to your local pharmacist, or talk to your doctor about different, whether there is any drug interactions with the medicine that you're either wanting to start and the medicines that you're currently taking as well.
Does that go the same for supplements and vitamins and complementary therapies as well?
A common misunderstanding is that just because it's a natural supplement, that, it might not have any drug interactions or sort of implications on the medicines that we're currently already taking. That's not the case at all. So, vitamin and herbal supplements can certainly still interact with other medicines. So it's best to have a chat with your pharmacist or your doctor, so we can definitely make sure that, the supplement that you potentially are looking at, it will be safe to take in combination with the other medicines that you might be on.
Perfect. Thank you for that, Elise. We've got someone asking about the example that you gave all the way at the start with regards to that vitamin mineral supplement that contained lead. Now, not sure where it sits without being able to give out information of that. They were asking if that was tested independently to contain lead contaminants, and then if it was TGA approved and safe to be taken in Australia, or was it like an overseas medication that had been taken in and maybe contaminated?
Yeah, interesting question. So I believe this case, there was one particular case where it actually was a product in Australia, so it was a listed medicine. And without getting into the nitty-gritty of it all, listed medicines, when they're sold, the company, I guess, who are making it just have to make sure that they meet special criteria, so high-level standards to make medicines. The actual vitamin in this case wasn't actually individually tested. It's just that company, yes, we know they usually make medicines well, so we're happy for them to do it. And it was a listed medicine, so it's considered a low risk. Unfortunately, yes, it came up where patient had lead poisoning, got reported, and then obviously the company had to do an investigation about how lead was getting into their product. And I guess, look, this happens all around the world. Sometimes it's very rare. Fortunately, a lot of the time, it's usually in very small amounts where it's not doesn't cause any issues. But the good thing is usually when the TGA picks up on this, they'll act on it. So even if it's a really small amount, well, it won't actually, for 99.99% of people, it won't do anything. Because it shouldn't be in there, they'll make sure this is cleaned up before it comes back to the market. It can happen. It's very, very rare, but it has certainly happened within Australia as well.
Someone's asking about the third category they've seen, which is the OST-L brackets A.
Yep.
And they're saying that they've seen it on not many products, but a few. Can you comment on that?
Yeah, we deliberately left this out because it doesn't really add a lot of information. We're only aware of two products that are actually so OST-LA is listed assessed medicines. So basically, these are these low risk medicines where the company actually have given some extra information about their product. The only two products that I believe are listed assessed are orange hydrolyte. So that's if you're dehydrated and you need electrolyte replacement, so salt replace, the only product out of that whole range that's actually listed assessed. So I'm not really sure why they haven't done the other hydrolyte ranges are fine. They all do the same things. The main thing is really just the flavor. Sorry, it's just the orange flavor, for whatever reason, is the only one that the company have gone to the TGA and provided some extra information. So it's a listed assessed medicine. So it's got that little step above most listed medicines. But for all intents and purposes, if someone was dehydrated and needed something, I'm happy for them to get any flavor they prefer. There's another one by Caruso's. I think it's a liver product. Sorry, I can't remember off the top of my head. But that company has provided a bit more information, and that's another listed assessed product. But as far as I'm aware, in Australia, there's only two. So we didn't think we would put too much of a focus on it tonight. But good question. I'm very impressed someone picked up on that.
I'll jump in there. So the Caruso's one is not a liver product. It's
sorry.
a prostate. It's a prostate product.
Prostate. Sorry, that's right. Sorry, prostate. That's right.
Someone's asking if there's a service to review the medications when somebody takes a lot of different medicines and supplements and things like that to see if they can contradict each other. Is there actually like a service that someone can, have in the community?
Yeah, so currently pharmacists do actually provide a HMR service, or a home medicines review service, and your local GP, for example, can actually ask for a pharmacist to come into your home, review all the medicines that you're taking, and do a sort of review of all your medical conditions as well, and actually see whether everything that you're taking is appropriate. Is there any interactions? Do they contradict? Are there any potential side effects that you're experiencing that could be contributing, that a medicine could be contributing to? So that is one service out there. And then, of course, us here in Medicines Information are available as well. You could give us a phone call and we're able to help, help navigate whether, the medicines that you're taking are all appropriate, and whether there are any sort of interactions or things that sort of contradict each other.
So the home medicine review is sort of like a really nice personalized deep dive into your medicines. I mean, sometimes it's really hard to get a doctor's appointment, and sometimes they're over in, 5 minutes or 10 minutes, just because obviously they're quite busy. The home medicine review can just take that time and go through all your medicines in detail, which is a really fantastic service. And your GP or even your pharmacist can refer you to one of these services. Whereas if you sort of just got some questions that you think your local pharmacy can answer, they can do so, or again, you can give us a call as well. But yeah, really, really good question.
Wonderful. And I'll raise as well that the HMR, the home medicine review pharmacists, they're kind of the next step up as well. It's an extra little level of testing and things like that. So it won't always be just the pharmacist, your local pharmacist and things like that. It'll kind of be like a specialized pharmacist as well. All right. Well, thank you very much both for your time. Really appreciate it. That's kind of all the questions we've had come through. Again, I'll send out in a couple of weeks the recording of this webinar. I really appreciate both your time and the time of everyone who's come along tonight, and hope you enjoy the rest of your night.